Hello. Welcome. I'm Jonie. I will be in charge of you today. Let's start by taking your vitals, okay? How are you feeling? Good. Okay, the doctor's gonna be with you in a minute. Very well. Let's shake those lungs. Good. Okay, why not deep breath in, please? Good. Now we're gonna do it in the back. Deep breath in. Breath out. Perfect. Thank you. So you're here for a consultation. You're gonna have plastic surgery, right? Very well. So let's see, how is your blood pressure? I'm gonna apply this in your wrist, and it's gonna be pumping some air so we can shake it out, okay? Very good. Doing good. Okay, seems great. Blood pressure seems pretty good. Okay, so now let me just ask you a couple of questions. Have you had any infections in the past 3 months? Let's say a throat infection, maybe a wound that got infected, anything of that sort? Nothing? Okay. How about, did you suffer from COVID or influenza or even a cold that you got with fever? Okay. And in the past month, have you been to a hospital or have you donated blood? Okay, very good. So the doctor is gonna be with you in a minute, so just relax while she comes back, okay? Hello, I'm Dr. Whispers. Nice to meet you. Very well. Okay. You're going in for plastic surgery. Been having a few issues with headaches, and it was diagnosed that you have problems with your nose, right? A little bit dilated. Okay. Yeah, sometimes it's pretty rare, but it's something that can happen when our nose is not positioned well. It can press some of our sinuses, and this create very hard headaches and migraines. And with you, we have done quite a lot of examinations, and yeah, so this is our final consultation for your plastic surgery that we're gonna attempt to fix your nose, okay? Very well. So I'm gonna be using this tool to look inside your nose. It can be uncomfortable at first, but it's necessary to check out how the area is looking, okay? Very good. It's gonna be a little bit cold. Please work with me here. Okay, so we're gonna be looking up, please, like that. Okay, can definitely see it there. Okay, good. Well, it's mostly located on this area that we need to fix. We are gonna be opening the area and shave a little bit on this part to release some of the pressure that is located there. Okay, I'm gonna be pressing the area right there. Now I'm gonna move it this way. You're gonna feel a slight relief, isn't it? It feels better there. Yeah, now I'm gonna be putting it right in and move it to the other way. In this way, it feels more pressure, isn't it? Kind of triggers a headache. Okay, I'm gonna release it. So now I'm gonna be pressing in this part. Right there. Do you have any pain in that area in particular? Not really. Okay, we're gonna be doing it this part. And now I'm gonna locate it on the way that we are gonna perform the surgery. Right there. How do you feel? Bit better. Okay, that is good. So now any sort of surgery in the area of the nose is gonna change it, its shape, maybe its size, and it can be noticeable to others that you had something done to your nose. But we are going to be trying to be as delicate as possible to not change the shape of your nose. Or in case that you're looking for an aesthetic change, it can be done at the moment. But I don't find anything of that sort in your file here. Okay. So now, since we are going to be shaving this part here, now can you look to the side, please? So we're going to be shaving this part here that I'm touching. So your nose actually is going to be ending up a little bit smaller. We're going to try to maintain the same shape, but it is going to be smaller since we're going to be shaving that part because we want to release the pressure that you currently have right here. In this part. I'm going to do some markings right here. You can also do a little bit of a pull in this area and right here too. What I don't want to do is touch much of this part here, but up in this area, which is the arc of your nose, we're going to be shaving it quite a lot. So let's try to move it along here. Now I would like to know if there is any problem with switching the shape of your nose in case that when we are inside there we find a different kind of situation that we need to make a decision in the moment regarding the shape of your nose. Now it's not something that is going to be too dramatic, but it's maybe gonna be really noticeable that something was done to your nose. Some people feel a little bit not ashamed, but conscious about their nose, that it has been touched or done, and they don't want nothing to do with that, and it's completely fine. So I just want to know if it's okay if that happens. Okay, very well. We're going to be giving you a release form with all that information. I do suggest you to read it thoroughly before signing it in case that we end up changing the shape of your nose completely. We're going to be trying to be as delicate as possible and not be too aggressive on how we fix it, but the main thing that we're doing here is helping you with the pain and discomfort that you're having. These are decisions that are going to be taken in the moment, and we need to know if you agree with those. Yeah. Okay. So it's going to be here. I'm going to press the area too. Now, right now, how you feel it when you breathe in is kind of, maybe you don't notice it because it has always been like that, but once we fix it, okay, it should be like this. It feels quite good, right? Now, give me a breath in. It does, right? It feels really different. It feels like you can take in more air, right? Can breathe better. Yeah, it's because your nose is deviated to this side. It's applying a lot of pressure on the sinuses here. You tell me that you don't remember any trauma to your nose, and you don't know anything that might happen. Sometimes we don't even notice that it happens when we are kids. Maybe a hit by a ball, we crash to something, anything can completely move our nose, especially when we are kids, when we are still growing. And when that is not fixed when we are a child, it tends to get these troubles. So I'm gonna leave it like that. Now I'm seeing here that Nurse Jonie took your vitals. Okay, your oxygen levels right now are in 98%, which it's fine when we have a cold. So you are permanently having like a cold because you're not breathing it properly. Once we fix your nose, you're gonna be breathing at 100%, 99%, like everybody should do. So we are very happy for that. That's something that can actually be changed, and that we are definitely gonna fix your issue with headaches. Okay, it says here that you have been taking over 600 milligrams of ibuprofen. That's quite a lot. And you have these headaches very often, which is not good for your liver to be taking that big amount of medication every single week. Yeah, no, it's not good at all. We're gonna have to send a blood lab to check how are your liver levels. Hopefully it's nothing too serious and something that can not be reversed. Okay, so I'm pretty happy with the markings and how it's gonna end up. And we have now decided that it's okay if your nose shape gets changed in the last minute. We're gonna try not to do it. We're gonna try to, as I was telling you, be very delicate with it. But I'm glad that you gave us your permission to go a little bit further in case that is necessary. Hopefully it's not gonna get to that, and we just need to do this. Okay, so now something that I'm gonna be telling you: after this surgery, you're gonna end up with some bruising and hematomas in your face, especially on the eye area. This is gonna leave you with that for around 1 week to 2 weeks. Depends a lot with the person, but it's gonna be strongly noticeable. You're gonna be able to live your life as normal, but it's gonna be completely showing all these bruises in your face, especially right here on this area. I want to tell you this beforehand because I don't want you to get scared, because that is something that is gonna happen. Your nose normally takes around 6 to 8 weeks to be wearing a bandage, and in your case we're going to put a little brace right here on your nose that is going to last for 2 months. Okay, this is to help the beard, the one that you have here, heal and stay in place. Okay, because you have lived almost all your life with this in a wrong position. Good. So I just want you to know that aesthetically it's gonna look like that. Well, it depends with the makeup. If you want to wear makeup, it's fine, but since it's bruising and you might try to remove it after, it might be uncomfortable. So I tell my patients, just own it, and it's gonna go away with time. But don't try to hide it, because it will require a lot of makeup, and after you're gonna try to remove it and it's gonna be uncomfortable for you. So yeah, I don't really recommend it. Okay, so we have you scheduled for next week. Very good. Normally takes around 3 hours, 2 hours. In your case, hopefully it's gonna not take too long, because it's not for aesthetics. It's just going in, shaving, and closing up. Hopefully, if we don't find anything funny in there. And by the afternoon, once it wears off the anesthesia, you can go home. Okay. Very good. So let me just take off the markings. Do you have any questions? You feel nervous? Please let me know. I'm gonna remove these markings here, okay? It's normally like a nose job, but in your case, we are not gonna be changing shapes or moving parts of the bone or anything like that. We're just gonna shape the parts that are a little bit crooked. Very good. So, any questions that you have? Very good. So we are all set up. Now I'm gonna give you a copy of the release form. I wanted to take it home, read it thoroughly, and if you accept, we're gonna be sending you an email where you can sign it directly. So there's no need to bring this back. It's just for you to read it. Okay? And if everything's good, your surgery is already scheduled, and we're gonna go ahead next week, okay? Any other questions? Very good. It was my pleasure. Thank you so much. And right here in the reception with Nurse Jonie, she's gonna give you your form. Very good. Please take care, and see you next week. Bye-bye. Hi, I'm Jonie. I will be your esthetician today. Let's see. Oh wow. We are here for the steam treatment. Quite relaxing, let me say. I have tried it and it's just marvelous for the skin. Okay, it says here in your information that you're looking to open up your pores, release toxins, and most of all, have a relaxation time for it. I don't see any medical issues to be concerned of. Although it doesn't say that you have any issues, we need to perform a little examination beforehand just to make sure that there aren't any problems that can cause different kind of situations with the steam treatment that we're going to be doing today. Okay, good. Now you requested the natural steam treatment, right? No aromas, aromatherapy, anything like that? Very good. Normally for treatments for relaxation, like the one that you're gonna have, most of my clients prefer to have some sort of aromatherapy. Others find it a bit maybe distracting. They want to focus more on the sensation other than the aromas. Yeah, I bet that it's different for everybody. I myself prefer to do it without aromatherapy. So let's take a look at your skin. Now I'm trying to see if there are any cuts or anything that it's an open injury, sores, things like that won't let us perform it because the steam that we apply is quite warm, and if you have open sore skin, it can hurt a little. Thank you so much for coming without any makeup on. I just see a bit of blackheads forming in these areas in particular, and the steam is going to be great for it. So just gonna take them out. Do you have any skin allergies? How do you know? Okay. Very well. I'm gonna check your skin with this instrument here. Very good. In this area where the blackheads are, it's a bit tender, but I won't worry too much about it. This area here is also safe. Yeah, I do believe that everything is in order. Okay. Well, let me just start prepping your skin. Let's see how is your moist and oil levels. Okay, press it directly into your skin here. Like so. okay. Your moist levels are quite low, as you can see here, the same as your oil levels. But once we apply the face mask, it's gonna be back to normal. We really want to have them between 50%. Above 50% is great, is into normal levels. Anything below that means that your skin it's dry and is in danger of having cracks or even infection in some areas, especially during the winter that it gets even more dry. So we want to correct that before that cold weather start coming. And the warm steam is going to help quite a lot with it, because we're going to unclog your pores. That is going to be able to produce these natural oils that you can do on yourself. In other cases, it requires a little bit more of help, but with the face mask and the steam, we're going to know if you need that or it just needed to be unclogged. I'm going to start hearing some noises. That's the steamer building up. Like this. Yeah, that's the steamer. It's quite noisy. Yeah. I'm gonna put it aside here. It starts working. There we go. Much better. I feel quite nice. Yes, you can open your mouth, there's no problem. And it's actually gonna feel good in your throat. Nice aroma. Just steam. If it feels too hot, let me know, okay? It's gonna get very foggy, that is normal. Almost over. Excellent. Now it's time to work. I'm gonna be using this soft bristle brush to start cleaning up your skin. Yeah, it does feel good, isn't it? How we open up space. It's actually a good treatment too for the hair. Good. Let me do a little test here. Let's see how your levels are now. It's getting up. We are right now at 40%, which is good. This is telling us that it's not a problem that you cannot produce the oils. It was a problem of clogged pores. Now I'm working more in these areas in particular that you're having the problem with the blackheads. Right now it's almost unable to see them, so that means that the treatment worked very great to unclog those areas in particular. Yeah, quite good. Let me check here. That's very, very good. Apply this in this area. It does feel a bit colder because of the warm steam. Your skin still feels warm, so it can be a shock with this solution that I'm applying. If it's too much, let me know, okay? I can always try to do it in a different way. You're fine? Okay. Let's leave that on for a bit. Now what this does is just remove the remnants of the clogged pores. With the exfoliation that we did earlier with our brush, we were able to remove almost everything. Sometimes there are a little bit of parts that tend to be more difficult, right? Okay. Does look better. quite nice. Let's continue with our roller. This is my favorite part for the roller. It's quite relaxing, to be honest. Sorry, let's move your head like this. Let's check that area in particular that I was talking about. Yeah, it's all clear now. Your pores are very, very neatly now. Good. Okay, very happy to say that we are back at normal levels with your skin oils, which we want to be right in the middle, around 50 to 60%. Anything higher, it tells us that we have an oily skin. And even though oils are good for the skin, too much can cause problems like acne and things like that. So we want to keep them right in the middle. With you, we are at barely 50%. I wasn't able to go higher. It must be your skin type in particular, because the diet that we eat also influences how our face reacts to it. So we can try again another testing probably in about 2 weeks that your pores are still gonna be clean, but we have passed some times with your normal diet and see how that influences your skin. And then we can maybe try a different treatment for it in case that is necessary. If your levels go back to lower than 50%, let's say 20 as you were before, you will definitely need a whole treatment with creams and things like that to help your skin soothe. But right now you are at barely normal levels, which is good. I don't know if you would like to make up an appointment for next week too. I'm sorry, 2 weeks. Okay. Let's see. When do I have an opening? I have one 2 weeks from now, same day, same hour, if you're available. Okay. We're still going to call you to confirm the appointment. Okay, I have your information, phone number, email. Which are the preferred method, email or text? Very well. So from now on, during the next 2 weeks, there's no need to do anything special. But I would like you to, maybe in your phone, in your notes, whenever you have time, to put some notes on how you noticed your skin that day. If it felt dry, if it felt that it was itchy, or especially itchy or a burning sensation are key parts of knowing that you have a dry skin. So I will take into look with that and bring me the notes in 2 weeks so we can check them up. Okay? Is there anything else I can do for you today? Well, it was my pleasure. Thank you so much. And don't worry, you don't need to do anything special next. Just keep up the notes if you can. Very well, thank you so much. Right here in the reception, and you're gonna have your notes for your next appointment. Of course, please take care. See you in 2 weeks. Bye bye. Can you send the next patient, please? Thank you.